that the healthcare industry, in particular, the healthcare industry under the federal government, we're looking for identity solutions. And you've been hearing about the levels of assurance. Well, we had gone forward in 2004 with Policy Memo MO404, which defined 4 levels of assurance for the federal government's identity ecosystem, which are being adopted nationally as well as internationally. But at that time, we're having dialogue within the healthcare community on levels of assurance, what would be needed for the emerging NHIN and their electronic health records initiatives, and the types of assurance that would be required, and they were seeking identity solutions. So we sponsored a pilot program at the time for high-level identity credentials within the healthcare arena. Solicited the HIMSS, the Health Information Management Systems Society, to recruit for us a number of RIOs across the country, regional health information organizations, that would participate in this pilot where we would register individuals, and we didn't specify who those would be. Healthcare practitioners, patients, providers, could be any of the participants in the healthcare arena. But what we wanted to do was establish demonstrate an identity solution for high-level identity credentials that would be used for real business practices in those RIOs or potentially across those RIOs. What we did was use PKI. Now, a lot of people were apprehensive at that time, not just in healthcare, but in other industry sectors for PKI and the issuance of digital certificates, but we targeted level 3 certificates for use in this demonstration pilot. We recruited half a dozen different RIOs, volunteered for this program, and what we used was localized registration agents within those regional health information organizations to be trained and certified as registrants, enroll individuals, either healthcare practitioners or others, within that regional structure, to be issued credentials, certify the registrants, so that there was a common base level of identity management, identity proofing, binding of the credentials to the individuals. We went out, we trained all of the registrants, we certified the registrants, and they conducted enrollment procedures. We oversaw that activity so that it was standardized. And the point was to have standard registration activities as well as standard credentials across the RIOs so that we could have trust within the RIOs for the credentials that were issued, as well as across the RIOs for any inter-RIO activity that could be generated out of this pilot. We didn't specify going in what the business processes were going to be. The focus for this project was to be able to demonstrate that there can be identity solutions at high-level assurance within the existing infrastructure that would make sense. And we wanted to then follow up on the business practices that were used, gain input from the participating RIOs, as well as some lessons learned and what we could do going forward. All of those RIOs certified their registrants. They enrolled practitioners principally but not exclusively, into the program. For each RIO, we issued 25 certificates, credentials for use. They used all of them. And they conducted different business processes. They weren't the same across any of the RIOs. And we never really got to the point in this pilot program for inter-RIO transactions. But the point was this. We were able to implement an identity solution for standardized identity management, enrollment, and identity proofing across regionally distributed organizations using the existing infrastructure, using level 3, high-level assurance credentials. Today, the healthcare industry is also looking for identity solutions. So I'm not going to point just to that pilot. I only use that to demonstrate that now, with programs like this one, where there's the opportunity to again demonstrate in one or potentially more areas common identity management, identity proofing, identity enrollment procedures, issuance of credentials that can be trusted within that community, RIO or otherwise, or across for inter-community transactions. And for those that have been in attendance here, you've heard a number of terms consistently about Nstic that we're interested in. Well, identity federation, how common, standard identity management practices across organizations can be trusted, not just within that organization, but on a national basis. And we've also heard the concept of identity frameworks, where in order to be able to trust those procedures, we want to see them documented. We want to see procedures that follow a base level of requirements for how identity management, identity proofing, identity binding is conducted by different organizations, different trust frameworks, Kantara initiative being one of those. So it's very opportune that Kantara is one of the co-sponsors of this project to be able to demonstrate how an identity assurance framework, Kantara, that's been recognized by the federal government, adopted by FICAM, can be used to be the framework for trust across providers, across potentially more than one location, and to be able to demonstrate how identity solutions within that context can be used as, can be developed, implemented, and shown as a demonstration to support the principles that I think are really clear within the national strategy. So we welcome the projects like this that are taking initiative for a very clear need, once again, the need for identity solutions in the healthcare arena, but also to be able to demonstrate the very clear principles that are announced in the national strategy. And we look to projects like this, for that demonstration as we move forward with the national strategy to be able to take those principles into infrastructure.